and welcome to Your Health Matters Let's Talk. Now, Your Health Matters Let's Talk is a monthly discussion program that focuses on priority health issues affecting us in our day-to-day lives. On this episode, we are discussing childhood immunization. Help me welcome my guests on the program, Dr. Roma Chilengi. He is the Director, Primary Care and Health Systems at the Center for Infectious Disease Research in Zambia. Welcome to the program, Doctor.
Thank you so much for having me.
And just next to Dr. Chilengi is Dr. Penelope Kalesha Masumbu. She is the Deputy Director, Child Health at the Ministry of Community Development, Mother and Child Health. Welcome to the program, Dr. Masumbu.
Thank you.
Now, before we go into the discussion, here is a clip. Actually, we took two testimonials, one of a family that delayed to take their child for a measles vaccine, and also of parents that ensured that their child did go for all the necessary immunization before the age of 1. They share with us their experiences in the following clip.
Vuto ya mnena lipo pamembanga first sinenso kwenda continental. Paka nanyamuka naenda kumuzi kuli wa mai. Soka kumuzi kwa kaina kunali ni kutali na clinic. So kuti uyende uweka sinali chovuta ngati mwamuna akana kuperekeza. Nishikumbesha mene unga chite chonse. Chifuka choyopa nyama za msanga. Kuli wa mai kumuzi nankalako paka kufikira day yo papa mwana wanga. Na papa mwana wanga nankala naye. Nankala naye naona akula chapepuno. Kufikira paka afikisa 1 year 5. Anadwala abwadwala kansama nze measles ndipo inazibira kuti kansi kosapeleka mwana ku kliniki kwa under 5 ni vuto ikulu mwana uja chifukwa insana ni vuta nze mkondishoni yoipa pete nampeleka ku Chilundu hospital banaenda kumupima na kunikalipira na kunuza ati why siwenzo mbwelesa mwana kwa under 5 mwana sana landile manyerete aliyonse. So that's why mwana wako ankala so. Wetina mpeleka ku Chilundu hospital ndiko amina nabwira enda apolera. So pali uyu wanamba tu wao napunzidirapo nazioti hapa mwana wanga nifuni kumpeleka. Chifukwa problem nayo unapoyamba kuli mwana wanga first born mwamuna.
During antenatal care, we tell our mothers the importance of immunization because it is one of the important things that a mother should do for the good health of her baby. Immediately the mother delivers, when she's in postnatal ward, the baby is given polio 0 and BCG. Thereafter, we encourage them to say that should not be the last vaccine that the baby should receive. The baby is expected to receive some other vaccines in between, and is supposed to end with measles at 1 year 6. We even tell them the importance of receiving the vaccine, like preventing meningitis, preventing pneumonia, diseases like tetanus, diseases like diarrhea. Because if the child is not vaccinated, it means that child will have problems in the future.
Banena nkala na mimba, ninali kuyenda kwa antenatal. Kwa antenatal kuja wanali kutipunzisa kutaa mwana akabadu. Afunika first kulandira ama vaccine. So nyereti ya number 1 amene nali kulasa inali BCG. Yani balasa pa kwa njapa. Then mu 1998 ninabwera futi nankala na mwana wa number 2. So ninakonka chimozi ninaona kutika kulidoka oja mwana wamene nezopeleka ku manyereti anali kukula cha bebuno bwino. Continental ninali kuyenda ku chipatala. Under 5 vonse ninali kumpeleka. Mpaka na bana anakula bwino. Mpaka na wanakwanisa 5 years nikali kuwapeleka kwa under 5. So ubwino amene napezamo okupeleka bana kuti balandire manyereti. Nichakuti bana siba madwala. Kudwala bangadwale kwa mama pola musanga. Panali nthawi ina pamene kuna bwera kwenze measles amene inagwa mkomboni mwatumu. Bana bambiri banadwala. Koma ine banga sibanadwale.
Constance alina kwanisa 6 weeks?
Yeah.
Okay. So Constance tizamupasa nyereti ya 6 weeks ayi.
Okay.
Manyereti yo chingiriza bana muyaziba.
Yeah.
So Constance alichabe bwino, weti akula bwino apa, manyereti po badwa anapasiwa BCG tinamupasa na polio ya mukamwa. Lero futi tizamulasa nyereti apa pachibero yochingiriza tulaso kukunyuka bana na chifuba chijacho ipisisa tizamupasa futi na mukamwa yochingiriza polio futi mukayomuleta after 1 month pa 10 February futi tizakamulasa pachibero nyereti na mukamwa futi polio tizakampasa futi mu after 1 month azakalasiwa pachibero na mukamwa polio. So apa pachibero mwana azalasiwa manyereti yangati ya 3 then na mukamwa tizamudonyeza 3 times then akakwanisa 9 months Constance tizampasa nyereti yochingiriza measles. Constance pamene anabadwa analema 3.8 kg. So lero alemako nkasako 4.2 Constance so chilangiza kuti mwana uyu akula bwino. So timupasa manje polio ya mukamwa tizampasa konse karota azakabwera kuno futi kunyereti pa 10 February.
Doctor, that was a clip of childhood immunization and how various families respond to childhood immunization. Let me start with you, Dr. Chilengi. What are these immunizations and what do they do?
Thank you so much. I think that's an important question for the viewers. Immunizations in very lay terms is basically preparing the child's body. Within the child's body are defenses against disease, and these defenses basically we call them immune responses. So when we say immunizations, we are talking about those medicines or those injections that help the child's body to prepare to meet the infections that they will likely meet later in life. And when their immune system is so prepared, they are able to deal with those infections in a much more efficient way. If they are not prepared, then you have all sorts of problems with children meeting infections and then developing severe disease, and unfortunately many of them dying.
So Dr. Masumba, I'll move to you. What are some of these diseases that can be prevented by immunizations?
Yes, some of the diseases that are common childhood killer diseases and we target to prevent with immunizations include, you've already mentioned measles. We are aware that measles is a killer disease. Tuberculosis, we have polio, we have whooping cough, tetanus, and now we're having other diseases that are being included in the immunization schedule, which include pneumonia, diarrhea, and even other diseases like cancers, hepatitis.
So, Dr. Masumbu, you are saying when a child is born, they are prone to these diseases just naturally?
Actually, what happens is that when a child is born, the immune system is very immature. And in the first few months of life, the immunity is provided through breast milk. So the children will be able, especially if they're breastfed and more so exclusively, they'll be able to get some kind of protection from their mother through the breast milk. But as breastfeeding ceases, the immune system for that child has to be prepared to be developed, as Dr. Chilengi said, by us introducing some of these vaccines to the children so that the children are able to, in their bodies, mount some kind of response system that will be able to defend them against some of these targeted diseases should they meet them in future.
When are these immunizations supposed to be administered?
There are various schedules at which immunizations are best given to children, and these are decided upon based on a lot of considerations from research to try and determine what is the optimal time in a child's life when these vaccines will give that child the best preparation. So like here in Zambia, we have a very wide range of immunization times for newborn babies. For example, we give the BCG or vaccine against tuberculosis shortly after birth. And then we have a whole range of vaccines that we give around about 6 weeks of age. That would include your vaccine against polio, your whooping cough, your tetanus, your pneumococcal vaccine, and now your rotavirus vaccines.
So doctor, what would happen, Dr. Chilengi, what would happen if a child does not get any immunizations?
A child who has not received immunization is really tragic in our environment because, you know, we have so many infectious diseases and many of these are vaccine preventable. So the government has gone to great lengths to invest in immunization programs to prevent disease. If we have a system which we don't take advantage of and have many of our children unimmunized, then we are basically inviting problems that we will have our mothers and our parents in hospital much of the time, and then they will not be productive. And so the cost of these vaccine preventable diseases is very, very high.
Have you had any such cases of children not immunized?
Actually, some of the epidemics that we have had in the recent past are testimony to this. You may recall that I think a couple of years ago, 2-3 years ago, we had a measles outbreak. Basically, measles is one of those vaccine preventable diseases, and the prevention is so cheap and is very accessible in every public health facility. So for those people that may have been affected, the most likely reason is because they probably did not go to access this service and have themselves protected or have their children protected.
Infectious diseases, by the term itself, they move from one infected person to another person. Okay? So when you are having your population, your sort of vulnerable population, people who would be infected, when you have your community-wide immunization program, you basically break that transmission process. So even when there's one infected person, there's one infected child, and they are shedding these infections, the infections will not move forward when the others around the child are immunized. So when you have covered with your immunization programs widely, you create a community-level immunity which does not allow these infections to jump around from one child to another.
Where do the parents miss it, or the guardians?
Well, there are various factors that may contribute to non-immunization of children. Some of them include issues of physical distance from a point where this service is being provided. Some, say for example, like right now in the rainy seasons, certain parts of the populations are cut off because of floods. So sometimes it may be a challenge for these children to be able to come and access the facility. And the others include maybe parents not appreciating the importance of an immunization program. Parents may feel it is a bit too much for their child to be receiving too many vaccines at the same time. But basically the important thing is that all these vaccines we provide are safe, and they are also very important in terms of boosting the immunity. So we have some myths, misconceptions, sometimes even traditional beliefs come into play. We have some part of our populations that feel they do not need to access any health interventions. So we have quite a lot of work ourselves, with your help, the media, to ensure that we're able to talk to these populations and to convince them that this intervention that we're bringing forward is more beneficial than if they did not access these services.
Let's talk about the side effects of these vaccines.
Yes, the side effects. I believe any medical or biomedical product has side effects. Even simple Panadol, which people just go and buy at the street corner, has side effects. So likewise, vaccines have side effects. The most common side effects may include a slight fever that may last a day or two and will disappear with time. They may include, say for example, if it's a vaccine that's administered or given through an injection, pain at the site of the injection, maybe some slight swelling, but those tend to wane off within a day or two.
So doctor, why do you insist on children completing their immunizations by 18 months? Is it not the same as when a child completes them after 2 years?
children are most vulnerable when they are young, and so vaccines are about prevention. So you don't want to lock the stables when the horses have gone. So you want to basically immunize them early enough so that they have a normal development.
We do have an audience, but before we get to their questions, I would just like to find out what is the role of the parents, the guardians, in childhood immunization?
Well, basically, the role for the parents and guardians is to ensure that these children who they give lives to are actually helped to realize their maximum potential, both health-wise, mentally, and physically and socially. So from the health perspective, is to ensure that they provide or create opportunities for these children to be able to access these immunizations. The vaccines are free from the public health sector. We ensure that as part of meeting and ensuring that the child's rights are attained, we provide these services to ensure that the child actually attains a healthy life.
Well, doctors, thank you for sharing your experiences with us on childhood immunization. It is now time for questions from the audience. Audience, are you ready for the questions? Yes. Let me see those who are ready with their questions. Let's have the first question here, please. Yes, go ahead.
Thank you. My question is, I have observed that a lot more vaccines are being given to children at the same time, on the same day. Now, isn't that harmful? Thank you.
Dr. Masombo.
Basically, when you look at our immunization, I think it's preventing a total of no less than 10 diseases. So some of these vaccinations will be provided at the same time, some at different visits. So basically, when we look at this, we try to ensure that the vaccines that we provide are those that are going to target those diseases that are actually killing our children. You may want to know that we have one of the highest death rates amongst children under the age of 5. So if we as a country are going to tackle that, one of the most effective and simplest way we can do that is through provision of vaccinations or immunizations, as we have discussed.
These schedules of immunization are designed in such a way that they make it as easy as possible for the parents. You don't want the parents coming every other day to the health facility. So where it has been shown to be effective and safe, we have these vaccines bundled in one visit so that the mother comes to the health facility. At that contact, the child is given all that they are able to take in that particular visit.
Well, thank you so much, Doctor. Let's continue getting questions. Next question, please.
Thank you. My question is, why do you just give vaccines during Child Health Week?
I would like to take this opportunity to mention that vaccines are provided routinely from the beginning of the year right through to the end. In every public health facility, it is expected that we should have vaccination services or sessions ongoing. We have an immunization schedule, which starts from birth, then at 6 weeks, at 10 weeks, and whatever age. So if we're providing only during Child Health Weeks, imagine how long it would take for us to have a child fully immunized at the correct age. But what we're saying is that we provide vaccinations to children in the public health sector, in every public health facility at all times. So Child Health Weeks are only there to supplement efforts where routine provision of health services, particularly vaccines, has not taken place. So if a child missed an opportunity, we provide an opportunity to catch them during this Child Health Week. And Child Health Weeks occur actually twice a year, usually mid-year and towards the end of the year.
Thank you so much. Next question.
Thank you. How can we be sure that these vaccines meet the safety standards? Thank you.
Yes, Doctor.
Thank you so much. Vaccines that we introduce in the public have been reviewed under very stringent regulatory conditions. There are regulatory agencies and authorities internationally that will review the profile of a given vaccine, and only when that vaccine meets that standard do they give that approval that it can now be used in public. Now, much of that review is really centered around how safe is this product first and foremost. So there is no compromise whatsoever on the safety of the vaccines that we give. And remember, most vaccines, we give them to children who are healthy. So the standard for giving something to a healthy individual is very, very high. And the stringency with which these vaccines are reviewed is very high. So we only use vaccines here that have World Health Organization pre-qualified. And when those vaccines come through, they are also further reviewed by our pharmaceutical and regulatory authorities here in Zambia. And so there are multiple steps through which that safety of vaccines is ensured.
More questions, please.
I have heard that immunizations are made out of killed disease, bacteria or viruses. Therefore, are they really safe for our young children? Please clarify.
When we are talking about vaccination, say around rotavirus disease or polio disease, the vaccines that have been developed that we have to prevent these diseases are actually what we call live attenuated organisms. Now, that's jargon. Okay? What it simply means is that the vaccine does carry a living organism that is similar to the organism that causes that particular disease, but through chemical means, it has been weakened to an extent that it will not cause a disease in the child. It will behave like the actual virus, but it will not be able to replicate and cause a disease in the sense that the real natural infection causes. So the process of manufacturing those kind of vaccines makes sure that they preserve the nature of these organisms, and yet they have weakened them so that when they are given to the child's body, the body will identify them as that organism and begin to prepare defenses against that organism. And the point is that once the real infection is met in real life, the child's system will say, oh, I've met this guy before. So this is the basis on which the immune system works.
Thank you, Dr. Chilenge. More questions?
Thank you. What should be done to parents who refuse to have their children immunized due to religious or traditional beliefs?
Thank you very much for that question. Indeed, we do have in the population some people that may not accept to be vaccinated or to be immunized because of various reasons. And some of these reasons include religious beliefs. For us as a program and as government and in collaboration with our partners, we try to ensure that we engage them. We engage with them to try and ensure that they understand the benefits of having their children immunized. And the benefits are so many, one of which is that their children will grow healthy lives without having to face diseases that can be prevented. So those are some of our strong points in trying to ensure that we engage with them. We try to engage with them through their traditional leaders, so that through their traditional leaders and even their religious leaders, we may have conversations and maybe to try and understand what it is exactly that is actually preventing them or hindering them from receiving these vaccines.
Well, Dr. Masumbu and Dr. Chilenge, thank you so much for sharing your experiences with us on childhood immunization. Thank you so much again for making an appearance on this program. Thank you. And to the audience, thank you so much for your participation. You've been engaged in this program. You've asked such critical questions. We'd like to thank you so much. To the people at home, thank you so much for watching. And we do hope that you can get in touch with us via our Facebook page, www.facebook.com/MOH Zambia. And that's it. Your health matters. Let's talk.
you're a